Hello, and welcome to our program, Life with Biliary Atresia and Beyond, navigating the transition from pediatric to adult care. My name is Morgan Harrington, and I'm the National Manager of Programs here at American Liver Foundation. ALF's mission is to promote education, advocacy, support services, and research for the prevention, treatment, and cure of liver disease. As part of our commitment to the liver community, ALF offers a range of educational programs and resources for patients, caregivers, and providers. You can find more information at liverfoundation.org. We want to invite you all to join our American Liver Foundation Patient Registry, the first ever patient registry for all liver diseases. Our goal is to help researchers better understand liver diseases and how these diseases, as well as current treatments, impact patient lives. The registry is open to all individuals 18 and older within the United States with any type of liver disease at any stage, including transplant recipients. The ALF Living Donor Network is the first national database designed to connect non-directed living donors with transplant centers across the country, a critical step in addressing the shortage of liver donors. Our goal here is twofold: increase the number of living donor liver transplants in the United States and eliminate the pediatric liver candidate waitlist. Please share this new resource within your network. With us today, we have Dr. Amy Taylor, a pediatric liver specialist at Cincinnati Children's Hospital, as well as Courtney Vranic, a pediatric liver nurse, also at Cincinnati Children's Hospital. We are so grateful to both of you for joining us today. Later in today's program, we will be joined by three of our patient advocates to discuss more about life with biliary atresia from the adult perspective. Dr. Taylor, I'm going to go ahead and turn it over to you now.
All right, we are so grateful to be here to talk about transition of care and wanted to give you the perspective from kind of the medical team and kind of the center of that from kind of the doctor and the nurse perspective. We have no disclosures. So we wanted to talk through some of the transition of care principles, and there are groups of physicians and care teams who are working on really kind of trying to figure out how to operationalize this and the logistics of it, and so how the healthcare transition happens for kids and young adults with chronic disease, especially chronic liver disease, and I think that as we share some of the literature, some of the research, some of what's been published. A lot of it is coming out of the liver transplant perspective. And so we just want to, honor and know that we know that not everyone has had a liver transplant at the time of transition. And so we think that that is important for us to also really acknowledge that this is the transition of care happens for kids with a variety of liver diseases, including biliary atresia, who have not had a liver transplant. So you can see kind of all of the different people who are involved in this transition of care. And we're going to just kind of represent from the perspective of the nurse physician team of that. There are formal and informal assessments of healthcare transition readiness. You can see across the literature that this goes from anything from medications to adherence to school to work to self-management, and really that there are kind of some timelines that they've suggested that might be helpful to kind of start introducing the idea of transition. I think most importantly, transition isn't something that's supposed to be kind of this cut time point and be like, and okay, and now you're going to be seen in adult care. That it's not meant to be an abrupt, it's supposed to be kind of a transition with this. And I think that from a physician standpoint, there are certain kind of areas that we talk about, but then also from kind of a nursing standpoint, there are kind of key areas to establish readiness. Courtney, I was going to see if you could say, because I know that you assess transition readiness as we're meeting with patients, and what are some of the things that you look for in your interactions with patients in and out of the clinic about transition readiness?
Absolutely. I feel like one of the most important things is talking to the patients specifically and kind of not always directing our questions to mom, dad, things like that, and making sure the patients have an idea of their liver disease, what's going on, the medications they're taking, how they can go get labs, how they do just simple things. And I think just starting to include them early in these conversations and kind of gauge their knowledge, where they are in this process and where we maybe need to then spend more time in educating them and making sure that they know they're just as important and that the transition to them taking over their care is going to come at some point.
Oh, thanks for doing that. And I know that, Courtney, a lot of the phone calls that come in or a lot of kind of you're the first line for a lot of the messages that come in. And I was going to see, can you, how do you assess kind of readiness from kind of the messaging? I know that sometimes it's the parent and then sometimes eventually it's the patient, but just kind of how are you noticing that when working with patients and families?
Absolutely. I think the biggest thing too is talking to them about, we've talked to them frequently throughout their care with us on knowing that it's coming and again, establishing, having them take leadership and seeing if they're the ones messaging us or if we're the ones constantly reaching out with reminders of things here and there. And that's a really good gauge of if they're going to then be successful in the adult care world is if they're taking that responsibility, if they're the ones messaging us, or if they're the ones at least telling parents like, hey, this is going on, and not parents always being like, hey, we noticed this.
Yeah, absolutely. And I think it's great to be able to do that. And I know that sometimes when we're, preparing for clinic or we're talking through, we'll kind of go back over those. And I know you'll
Mhm.
share, okay, great, I was able to talk to this patient and wow, I'm so impressed. They called with their labs and said, hey, we got the
Mhm.
labs, can you take a look at it? And it's nice to kind of see that ownership as patients are growing up. And I think that's one of the things that we really look at, right? That,
Yeah,
this young adult may be ready to go into adult care with that.
absolutely. I think we can see a lot too in clinic, and I know we'll talk about this later, but in clinic, if they're the ones asking the questions, if they're leading these conversations, if it's not them looking to parents for all the answers or being too shy to ask a simple question of like, can I do this? And it's them really taking the lead and asking the questions and reporting how they're doing.
No, you're exactly right. And I think sometimes it's really neat when we're talking with patients and families. You can tell when families are also doing this as
Mhm.
well. When you
Mhm.
know that the parent or the caregiver has talked with the patient ahead of time, said, "Oh, remember you
Mhm.
wanted to ask this question." And sometimes
Yep.
they'll look and they'll say, "No, no, no, you ask the question, but we'll talk
Yeah.
about it." And it's always great to see when we know that the patients and families we're working on this together as a
Mhm.
partnership to be able to kind of reinforce that before the visit and after the visit, but
Absolutely.
also during it as well.
Absolutely.
Yeah. And so I think we'll also talk about it too, is that, this is helpful to kind of have as a framework or as kind of a guideline. This is not like set in stone. Every
Mhm.
patient, every family, every kind of, everybody has a slightly different timeline of transition readiness.
Mhm.
This is kind of just that overall framework. Um, we did want to say that there are some formal resources from the American Society of Transplant, and then actually gottransition.org. Actually, that we thought were really cool in terms of the transition portal. And there's some tools by stage. And so some of the care centers where you guys are at, um, may have these be utilizing these, but at least it helps by age and by development stage, kind of what things to be talking about. There's checklists and things like that. But wanted to kind of share those as kind of a supplement to what may be going on in the clinic. Um, and so we just wanted to highlight and recognize that there are lots of different barriers to transition of care. And I think it's really important that it's a big step to go from kind of a medical home to a new medical home. And there are lots of things and lots of things that we can work on together for this. This came out of a recent kind of guideline for this, and I think that this really focuses on I think on some of the barriers, but really going to focus on really how to empower patients, families, also medical teams, how to do this transition and to do it well. So I know that Courtney, you and I, when we're in clinic, we talk a lot
Yeah.
about, each other about, okay, how does this
Mhm.
work? How do we get a patient into, how do we get them into the ultrasound, or how do we
Mhm.
care manage this? And I know that there's a lot of different differences when what we've learned from watching our patients kind of go into adult practice. And so
Absolutely.
I know that you had thought about some of these from kind of the nursing care coordination
Abs
side that are different.
yeah, for sure. So again, in at least our pediatric world, we hold hands a lot. We help schedule a lot. I send reminders for labs when they're like every 3 months for our patients that get frequent labs. I send those reminders for maybe the families that aren't as on top of it. I help schedule ultrasounds to be coordinated with their next visit to make sure that they get done and that it's the most convenient for family. I know we have like follow-up lists of patients that might have kind of fallen off or not scheduled their follow-up in clinic like we usually do. And we reach out to them very as much as it needs until we get them scheduled or make contact with family. Um, we make those follow-ups in clinic and we really work with family on like, when's this going to work best for you? What day, what time? And we really kind of bend over backwards to make it work for families a lot of times. I know we have some patients too that transportation's an issue, and we work very closely with our social work team to get rides for them even to and from clinic, whether it be like Uber or if they have Medicaid transport to help them like know how to do that, to schedule that. And it's just a lot of hand holding, a lot of trying to go up and beyond for them, which we love to do. But then once they come to the adult world, it's not the same. It's kind of it's on them. Labs are on them. If they don't get them done as they're told, they don't get them done. There's not the reminders. Missing appointments isn't as swept under the rug and rescheduled quickly. I think a lot of care centers might then decline them as patients, or again, follow-up is then at the provider's next available date, which can be very far in advance. And if it's a sick patient, that's obviously not ideal.
Yeah, so it sounds like there's a lot, there's a lot that goes into kind of the care management, the aspects of kind of ensuring care delivery, timely, efficient care, and really kind of being another resource to be able to help guide the plan of care and those types of things. And so I think on kind of as kind of the physician side of it, I think that, there's a variety of different ways in which physicians will interact with patients. And so, I think that what we try to also teach is that, having the patient be an active participant in their care, making sure that we educate patients about in kids, this is what your liver condition is. These are things to look out for. As we're getting patients ready to transition, I, make sure, okay, look at your labs, know what your baseline is. I think that there's a lot of advocacy on the part of a patient that has to happen in the adult center. You come with your questions, why are we doing this medication? What are the side effects? Well, do you think this is the best and why? And I hope that we are able to build that into the clinic appointments and our discussions with patients and families. But as this kind of table shows, that a lot of times the clinic appointments are going to be shorter. They're going to be seeing more patients. Hopefully they know your medical history really well. But especially as you go into a new practice, they're not going to kind of know the whole, lifetime of history. And so it's kind of, unfortunately, the patient, really ends up needing to be an advocate for their care. And really
Absolutely.
have a voice in the care too. And so those are some of the things that we try to, right? We try to make sure that patient,
Mhm.
and I think this really speaks to the fact that it needs to be multidisciplinary, right? So that you and I both have eyes on it. I know
Yeah.
we don't have one of our social workers here, but if we need to, we'll also pull in our social work team,
Mhm.
have our pharmacists help, to try and make the
Absolutely.
transition as smooth as possible for patients.
Absolutely.
So this is just again kind of thinking through the core elements of transition of care. And this is, I think, to me, I think of kind of an idealized state, or the way of kind of looking at it, to be able to really form a framework for how patients transition care. And so there are some transition care and policy guidelines. There's the way that you can actually track and monitor in terms of going through these different steps. There's this orientation to adult practice, kind of learning the system a little bit. I think just like we talked about, being integrated into care, having those initial visits, and then having ongoing care. And I think this is just kind of to utilize a framework as the patients and families are thinking about this transition process, as Courtney, you and I are thinking, what are all the different steps that we need to do to make sure that this is successful for our patients.
Absolutely.
And I think as you and I have talked about it, there's real life, right?
There's real life that there is.
There's real life. And so I thought that maybe we had wanted to talk through a little bit about our process, before the clinic visit. And so one of the things that I think is important is that, Courtney, you and I do pre-visit planning.
And yeah, our team as a whole does it. I know we do it kind of together. Every provider, nurse team kind of does it different, but I know everyone does it. And that we take a look at these patients before clinic, weeks before even, look at their chart, look at their recent labs, look at imaging that we've done that's needed. And we have those discussions on, we need to make sure we follow up on this. Oh, this was in our last clinic note that we needed to discuss this or follow up on this lab. They're due for this imaging, and we try to coordinate all that. Again, coordinating care is we're like, they're due for their annual ultrasound. Let's see if we can get this scheduled before the next visit. So we have the results to talk about in clinic, and they only have to make one trip here. So yeah, our pre-visit planning definitely, we take a deep dive into all of our patients, into messages they've sent, issues that maybe have come up since their last visit, even problems with medication, getting medications, things like that. So it definitely is a deep dive into their chart and really what's going on at that time.
Yep, absolutely. And then I think it's important to say is that there's actually a post visit. So you and I, we also sit down, and our teams also review patients afterwards. Okay, what did we say that we were going to do? What's next? Did we follow up on the labs? And those different things. I think in terms of transition of care, you and I also try to have kind of conversations ahead of time. In terms of, we had talked about kind of transition of care. These were the barriers for this patient or for this family, and what do we need to kind of accomplish in this clinic visit to help, or even before or after, to make it happen.
Yeah. And then there's even the visits that are like, this is the visit that we're going to do the transition of care after this one, or the visit that I'm sure we'll talk about this a little later on, but the visit, maybe after they've seen that adult provider, and this is potentially that very last visit we're going to have with them, to kind of wrap up everything and make sure that they're comfortable. So yeah, there's lots of discussions we have before these visits.
Yeah. And I was going to say that, there's the very clinical aspect of, okay, here's the transition process, and this is what we have to do, and these are the things that we need to achieve. But it's really emotional too, right? So I feel like we also have to kind of mentally and emotionally prepare ourselves. Like, oh my goodness, like this is a really big step, and we need to celebrate it for the patient. But oh my gosh, it's hard too, right?
Absolutely.
And I think that's kind of the real life too. I'd also kind of wanted, we've talked about this too, is that we there are some clinics where there is a really integrated kind of, transition from pediatric to adult practice. And a lot of times this is happening within the space of liver and liver transplant. And we have some of that. So we work closely with our partner hospital at the University of Cincinnati, but we also have patients who, for a variety of reasons, may come from other places, may need to go other places. And so I was trying to think how many different types of referral places, and it has to be at least 10, right?
I feel like there's been some, especially recently with some of our patients that are going off to college, that families like, they're in a really good place right now. Maybe it is time, since we need to get a provider closer to where they're going to be in college. Maybe it is time to make that transition. They think they're going to stay there. That, I think across the country for sure, we've done a lot.
Absolutely. Yeah. And I think what's been beautiful to see is to see, our patients grow up and thrive, and do great and be able to have jobs all over,
Mhm.
have go to school. It's been really great to kind of see that.
Absolutely.
So, we thought we'd kind of talk about how we try to make clinics kind of a safe space. And I
Yeah,
think that's probably the bottom line of
absolutely.
our plan for our start for transition. Um, so for us, our medical team, so
Mhm.
I am lucky enough that Courtney and I go in together. And so we get to kind of tag team all of this to answer patients' questions. And Courtney, I'm always incredibly glad for you to be there. Courtney, you see things that I don't. You're able to kind of speak into some of the medical questions or some of the care coordination questions. And I think it's really great that we have the opportunity to work together in that way.
Well, and it's nice going in with you as well. And again, hearing the actual plan, hearing these conversations that you have with families on like the medical diagnoses and what your thoughts are. So it's always helpful to be, again, the team.
No, absolutely. And I think that we put this together as kind of as an example of kind of the
Mhm.
patient, the family, the medical team. And we know that there's lots
Mhm.
more behind, right? There's social work,
Absolutely.
there's pharmacy, there's like nutrition, there's a lot. But really in the core of this clinic appointment is typically
Mhm.
how we are. And I think the
Mhm.
dynamic of this is very different regarding depending on the patient, depending on the family, depending on
Mhm.
where they are in the transition. But we always try to kind of make sure that as our patients are getting older, that we're transitioning a little bit more of the discussion, the dialogue, the medical decision making towards the patient. Um, and I think what's been cool to see is we have a lot of families who are encouraging their child to do this as well and creating kind of a safe space for this to
Mhm.
happen.
Absolutely. Absolutely. And again, the safe space is open communication. And again, just making them, making it known that they're safe, what they tell us, we're never going to be upset with. I think like medications is a huge one, especially for these patients that are families are starting to give the patient the medication. It's on them. It's their job to take it. It's their job to do this. And then we see the labs, we know something's going on and we bring it up and just again reiterating to them like these are the labs, what's going on, and letting them tell us. But again, letting them know that what they tell us, we're never going to be upset with. We're here to help them problem solve. And if they're not taking the medications, well, why aren't you taking them? Is it because you don't know how to do the refills and family has given you those reins to set up the refills? Is it because you forget? I know you and me have done multiple visits with like having patients download like apps to remind them to take medications, things like that. But again, I think overall is just letting families and patients know that it's a safe space, that what they tell us that is we're going to work together as a team for any issues that are going on. We're never going to be mad at them for things that have happened. We want them to tell us. We want that open communication, which is the most important thing.
Yep, absolutely. And then I think that we also really try, there's a lot that happens in a clinic visit, right? And I think that also, to kind of help create the safe space is we've had patients who've, told us in other forums that we really want to make sure that mental health is one of the things that we talk about and we normalize. And so some of the things that we just normalize talking about in this course of the visit is, making sure that we assess for symptoms and for quality of life. We know that fatigue is a really big symptom for kids with and young adults with chronic liver disease, and it can have a huge impact on the ability to do things that you love and enjoy. And we want to have a pulse on that and see, is it because of disease activity or, hey, can we help with, how do we help mitigate these symptoms? Do we need to change our treatment? And that quality of life. And I know that really creating like a safe space for mental health. And I think, Courtney, the other thing that we should probably talk about is the fact that we will sometimes have observers. So we'll have nurse
Yeah.
observers, we'll have students, we'll have medical students, we'll have fellows. And I think the other thing that we will often do, especially when we're talking about something that may be sensitive, is we
Mhm.
will ask the patient, you are completely okay. We will have most everyone step out and we will talk about
Absolutely.
these things. Um,
Absolutely.
And so just to kind of, I think, empower our patients and our families to kind of let us know how this goes. And I would say we've had some patients who have, said, I really don't want to talk about mental health today. And I think we respect that too, right?
Yeah, absolutely. Obviously, we respect it. If there's concerns, we'll dive deeper. But yeah, if it's today's not a good day, this is just not something we want to talk about today. Yeah, we absolutely respect that and just let them know that if you do want to talk about it, we're here. If you get home and just want to send us a message of what's going on, do that.
Yeah, absolutely. And we've had people who've taken us up on that. They've,
Absolutely.
said, I want to talk in kind of a confidential type of a way. I'll
Hmm.
just give you a message and, have
Hmm.
really reached out on that aspect. I think Courtney, you
Absolutely.
touched about medications and adherence. And
Hmm.
so something I know that we do every time. So we do the medication
Yeah.
reconciliation together, which I think which is good. And sometimes we're able to kind of go through it.
Hmm.
We're able to find out that, what we have in the system is just completely wrong or,
Hmm.
sometimes somewhat wrong. But also a really good time to kind of like talk through what are you taking? How is this going? And kind of, I think, Courtney, some of the barriers that you've talked about.
Absolutely.
So I know, Courtney, you've also done a lot of kind of like a lot of the discussions with families kind of, on my chart or on phone call about
Hmm.
medications. And so I know
Yeah.
I was able to say, wait, did we, which, oh, actually this decision too,
Yeah.
as an additional check on that. And so,
Absolutely. Yeah, because I think sometimes that we change the medications and for some reason that doesn't get changed appropriately, like then in their chart, but again, being like, oh, no, we did do this. This conversation happened at this date. This is what the plan was. But yeah,
yeah.
following up on things that we've talked about and things like that.
Absolutely. And I think the other things we make sure that we talk about is school and activities, right? To make sure that kids are able to do the things that they love. I know we
Yep.
get a lot of questions about what is safe to do, what is safe for me to do, in terms of sports.
Sports.
For sure, for sure. Absolutely. I mean, yeah, absolutely. I think that we talked about that,
Mhm.
recently too. And it's always great to kind of have those discussions, but also to
Mhm.
get to it's the joy of being in pediatric practice, right? Is you get to learn, you get to watch kids thrive and you get to,
Mhm.
see how life is and see,
Absolutely.
how if you need to make it even better with your
Mhm.
and then really we talk it through kind of management and anticipatory
Mhm.
guidance too. And
Yeah.
so kind of, how's your medicine now? Is this working for you? And what can we expect going forward? So I know recently we've also had conversations about, we've had patients who say, okay, are there any medications that I don't need to take or that we can
Mhm.
decrease or those types of conversations, which are always good to have. And I think
Yeah.
that every time we do look at the medicines, we're trying to figure out, is there something that we can
Mhm.
we can change kind of
Absolutely.
aspect. I was trying to think as we're talking through, because we've had a number of patients who I think that we've really been great. It's been a really great partnership in getting them ready to be able to transition to adult care.
Mhm.
And I was trying to think, Courtney, if there was anything that you think, like any tips or tricks for how to help with this process, and how to help with like kind of these clinic visits or things that you've seen.
Mhm. I think the biggest thing is following up. And again, I know we are trying to get them into the adult world and where there's not going to be that hand holding all the time. But I think throughout the process, it's a scary process for them. They've been in the center or a pediatric center their whole life, whether however long that medical part of their life has been. But they feel comfortable here. They feel heard. They know their team. They know how to do things. So I think there is a lot of like just reassurance throughout the process, a lot of reaching out to them and being like, okay, this is what we're going to do next. This is then the plan. We're then going to do this, like XYZ. And just really being that person, being there for them and talking with them through the process and just like reassuring them and just like really helping them like spread their wings and fly.
Yeah, absolutely. Absolutely. And I think we also try to do, I think what we've also talked about is that every clinic visit will have some
Mhm.
components of these, but,
Mhm.
it might be, at one clinic visit, the symptoms are really bad. Fatigue is really bad. Itching is really bad. Or
Mhm.
we've had patients who have, just come out of, a hospital stay or a hospital
Mhm.
visit. And, that might be more kind of symptoms management,
Mhm.
mental health implications of those different things. And so we'll spend a lot of time talking about that because those are the
Yep.
things that kind of rise to the surface. And then, in kind of quieter moments where things are more stable and things
Mhm.
are better, we'll kind of be able to focus on some of these other aspects of it. And
And I think that's when we, again, whether it's a patient that we like need to start having the conversations of transition of care, or we've had it for a while, but then this thing has started, these symptoms, these issues, and then we're like, oh, like this was going to be the appointment that we're gonna do the referral, things were gonna happen, and we like are in the clinic visit, and we're like, no, this isn't the right time. We want to make sure we're setting them up for success. So like obviously everything can change in a clinic visit, even if they like hadn't been reaching out to us and they just come to us and like their mental health's not great at that point, or they're really struggling with XYZ, like we see their labs. So like it's always a fluent conversation of like, okay, like this was our plan, but we're gonna make a change.
yeah, absolutely. And I think that kind of goes to speaks to the safe space, right? The clinic is supposed to
Mhm.
be a safe space. The clinic appointment, we recognize that there's a lot
Mhm.
that go into it. Patients might, you have to get up, you have to drive. Some patients will
Mhm.
drive hours for a clinic
Yeah.
visit, or even sometimes we'll be able to do telehealth, but you still have to kind of get prepared for that. They might have,
Mhm.
gotten labs or imaging or all those, and there's just so
Yeah.
much that goes into it. And I know that we want to make that sure that this is a safe space, but really
Mhm.
also a space that is for our patients and our families, right? To
Yeah,
be able to get what they need to out of that appointment. Um,
absolutely.
I think we also do because I know that I know that sometimes I will forget things if I'm going to be seen. And so we will also offer, hey, if you think of
Mhm.
anything else, just message us, right? Just, we are available and willing to talk more about it. Or if you kind of,
Absolutely.
you know, I think the driving on the way home, right? The drive on the way home when you're talking
Yeah.
about something, oh wait, like let us know.
Or that's when the families will message us, be like, oh yeah, so
Yeah,
and so meant to ask you this, and all of a sudden this is a concern. And that's why we're a phone call, we're a MyChart message away. Please,
absolutely.
please don't go home and ponder these questions for the next 6 months. Reach out to us
Absolutely.
and let us help you.
Absolutely. And then also too, I think on the other end, sometimes we'll sit down, after the visit and we'll kind of go through everything and be like, oh, we also need to do this too. And so we'll
Yep,
follow up with patients and families too.
absolutely. And that's kind of our post-visit conferences that we have of things came back or we thought of this, and yeah, making
Yeah.
sure things get closed and tied up and everything's taken care of.
Yeah, absolutely. But I also think that we use the clinic appointment as a snapshot in time, but that is not where all of the medical care has to happen.
Right.
It happens before,
Absolutely.
during, it happens after as
Absolutely.
well. And I would say medical and psychosocial care too.
Mhm.
So kind of thinking about the transition of care, I know that we kind of put
Mhm.
together what we think about it. And so this is kind of how we assess it, and it's loose, right? So it's looser. Um, and so I think the number one thing we talk about is to have a primary care physician. So, and Courtney, I know that you will often send
Yes.
messages about this.
Yes.
So um, so I think that, when we talk about differences between adult care and in pediatric care, um, oftentimes a liver clinic is the medical home,
Mhm.
right? The hepatologist is thinking about, okay, what about nutrition? What about growth? What about, social health? All of those things we talked about, hey, how's kidney function? How are these other things? But
Mhm.
really in adult care, what we've learned, really from experience and from watching our patients transition is that the hepatology care is one part of the care, and the primary care physician may do more of the actual management. So
Absolutely.
those healthcare maintenance, so kind of like
Mhm.
types of screening, healthcare maintenance, they will be able to do kind of, if you need to have like blood pressure, like do a lot of
Yeah.
other things too.
Yeah.
Um, and
In the adult world, the GI providers aren't as willing to wear multiple hats as some of our pediatric providers are with even, I mean, different GI diseases. There's the designated providers that will see them. So they might go from seeing just you to seeing 1, 2, 3 GI providers at an adult care facility.
That's really true. That's true, especially if you have kind of liver disease, but then also some other gastrointestinal concern that we kind of help manage for both.
Yeah.
Or even sometimes we'll have young adults who will have G tubes, and that will either go to that will be need to be managed by the primary care provider or a dedicated gastroenterologist. That's a really good point too. And then I think we talked a lot about it. It's important to know medications and doses as part of that. You kind of highlighted the process for medication refills.
Yeah.
Absolutely. And then really, I think, Courtney, you have a really good pulse on the communication part, right? So I know that you can tell, how well communication has gone and or is going and those types of things. And then I think the other thing is, knowing how to schedule labs and imaging, how to call. Because I think it can be intimidating when you have to call into an adult provider and say, I need this or I need to do that. And so we kind of we assess those different things. So other special considerations. So we recognize that a lot of people aren't just transitioning hepatology care and liver care. They're transitioning for a lot of other providers. And they, as you're doing this process with one provider, you're doing it with multiple other ones. And so I know that, Courtney, you think a lot about this too as you're transitioning patients and actually sometimes coordinating that care coordinator role with the other teams. Did you have any thoughts about kind of subspecialty transition or how we've kind of handled it or how you've seen it go well?
I know again, our platform Epic's great of being able to message other subspecialties throughout the institution, and it makes it very easy to communicate to other providers, nurses, things like that of like, oh, we're transitioning. Are you guys looking to transition as well? Are you guys holding on to them for a little bit longer? And I know we've reached out to some other providers too, if they're seeing maybe cardiology or endocrinology or something like that, of like where their adult care preference is going to be. We've reached out to other providers and then to help coordinate maybe like, oh, well, maybe this would be a good fit for the GI care too. So they're not going then all of a sudden to like one institution to transition to the adult world at multiple institutions. So I think working with the other specialties throughout Cincinnati Children's, and helping the coordination, the transition of care to the adult world go as seamless as possible.
Yeah, no, I think that's exactly right. And then Courtney also touched base on the kind of if patients were medically stable. And so I think it's really important to know that, the goal is not to say, all right, time for adult care, but, you have all of these things that are unresolved.
Absolutely.
And so the goal is to kind of make sure it's during kind of a stable period, there's not where it's going to be a safe transition.
Which is again why I think we start these conversations very early, and if we get them to a place that they are maybe ready before we're really ready to send them, but like it's a good time, like we do it then versus waiting for something to happen and then be at a point where they can't come here anymore and us just really be in a tough spot.
Yeah, no, that's great. It's always better to do it in kind of a controlled fashion than in a kind of an urgent, emergent type situation too. And then I know that we talk through like resources for transition, transportation. Are there other things you would need? And then I think that we have conversations, right? We talked about that we will transition to kind of our partner adult hospital, but we also have lots of other places. And so I know, Courtney, sometimes when you're talking with patients and families about this, you're having these conversations too.
Yeah, absolutely. And again, it could be anything from, well, this is where you're going to school, but is that really where you're going to stay? Are you still going to be coming home in the summers, weekends, holidays? And then like, do you want to end up back in Cincinnati, or like, are you going to Boston and that's your goal? You're going to be there. Like you want to stay in Boston. Are there two locations, two different institutions that might be convenient for you? But helping us narrow down and pick the best one for you that we think is going to match your care needs.
Yeah, absolutely.
And I know you have great relationships with a lot of different institutions and providers at different institutions that specialize in different liver diseases, and you kind of can gauge, I know this place is closer, but maybe this one is a little further drive, but this like they're so specialized here in your disease that this might be worth it for you. So I know it's working together as a whole and figuring out what's most convenient for family, but what's going to be the best for the patient at the end of the day.
Yep, absolutely. And when I realized that we were going to have to start transitioning these very precious, precious patients and young
Yeah.
adults, I realized that as I was going to kind of national conferences, that I needed to create a network of people who I think were open, because I think
Mhm.
you want to identify providers who aren't afraid of pediatric onset
Right.
liver disease and are comfortable and will are used to kind of or understand, I think, how care practice happens. And so
Mhm.
it's been really fun to get to know adult providers and trying to identify, are you willing, and actually, well, I'll have conversations with them. I have
Mhm.
pediatric patients who live in your area. Are you
Mhm.
open to taking patients, and can we coordinate? And they've been really wonderful about that, and it's been really helpful. And so I think that this is what we do. Um, I would say that the thing that has surprised me the most about when we try to transfer patients is just the time that it takes. It's not okay, great. We're ready to do a transition and
Mhm.
great. I think the papers are that said, have that clinic appointment happen within 3 months. And I think very
Mhm.
rarely are we able to really do that
Right.
in practice. And so, Courtney, I know that you do a lot of this part of the management. And so kind of what is your process?
I think the biggest like shocker too is just seeing how different institutions accept referrals from us. Every institution, I feel like some of our partner ones, I've fine-tuned that process and it's pretty simple and straightforward. But then there's the ones that we haven't referred to it before, and I'm like digging through their website, calling people, trying to figure out how they prefer these referrals to come through to make sure that they A, get the referral, and B, like it's a timely process of getting these patients scheduled. Sometimes it's a simple form, sometimes it's a very lengthy form that requires multiple like clinic visit notes, insurance information, um, things like that. And then obviously getting them scheduled. It's in theory, yeah, 3 months would be great, but a lot of these adult providers are far and few between, depending on where we're sending these patients off to, and their wait list is 6, 7 months. And then that's why, again, assessing readiness is so important, because we can't schedule this appointment 7 months from now and then all of a sudden have our patient no show their initial visit with them. And then that just is gonna really be failure for everything moving forward.
Yeah, no, absolutely. So to kind of be able to do that referral, and then also to
Mhm.
make sure that the patient isn't in limbo while they're waiting for that
Yeah,
appointment for 6 or 7 months too, that they still have a medical
yeah.
home and
Which
those
is
types.
why I think you do it so well that even if we're going to we're like, we're doing this referral, it's happening, we're going to move forward, you're going to see this adult provider. We schedule that follow up with them. We schedule, whether it's 3, 6 months down the road, we're like, okay, we're going to schedule our follow up. We're going to bring you back here to
Mhm.
talk about everything, to talk about how things went. If you have questions, if there was kind of discrepancies in what we've done for so long and what the adult care provider is saying, again, you're becoming an adult now. Their knowledge in the adult world is the best. But we can
Mhm.
talk about that and make you feel comfortable and make sure it's a good fit for you. And then,
Yeah.
but again, too, if they see that adult care provider, everything's great and wonderful, we tell them to like message us, let us know, and like say, if we don't need this follow-up visit, we don't need it. But I think having that follow-up and continuing to make sure they have a medical home is important.
Yeah, I totally agree. And I know that I jokingly will call it dating a hepatologist.
Yeah.
So we'll say, go date a hepatologist, see what you
Mhm.
think. And if it's if it works out, great.
Mhm.
That's awful. But we've also had where we've had people come back and say it was not a good fit. The
Right.
institution was not a great thing. And then we kind of go
Mhm.
back to the drawing board and we try to work on things
Absolutely.
as well. Because the most important thing is to make sure that patients feel safe, that they feel heard, and they're going to
Mhm.
get excellent care. And we want to make
Yeah.
sure that we can help and partner in that for sure.
And then I think the amount of times that we've had patients come back to us for this, what we think is a follow-up visit after they've seen this adult care provider, and they're like, oh no, we haven't seen anyone yet. And we're like, oh, you haven't? Like, that was the plan. Like, we sent the referrals, like we gave you all this information, and like,
Yeah.
and they just like don't reach. Again, this like goes back to gauging if they're really ready. They're like, oh, like we didn't reach out, or they didn't reach out to us, so we didn't tell you. Like, so again,
Yeah.
it's just making sure that then they're not lost to follow up entirely.
Mhm. No, that's true. And then we've also had patients who have kind of come to us and said, I am ready. I am good to do
Mhm.
this. I am ready. We'll place the referral, they'll
Yep.
go, and then they'll send a message like this was great.
Yep.
Then, we'll be sad we didn't get to see them again, but
Yeah.
really glad that they were able to kind of get that care handled in a
Absolutely.
Absolutely. And so I think what, we've created kind of these processes, but really it's very individualized and very
Yeah.
different. But it sounds like, I know that we try to equip our patients and our families with resources to help. And I think it's good for our patients and families to know that there are external resources. There's ways of doing it,
Mhm.
and really support for this process to make sure that it's done well.
Absolutely.
All right. So we can go through some common questions that we get. Um,
Yes.
so common questions. All right. So we
Yes.
get, when do I have to transition to adult care?
Absolutely. And this, I feel like is, again, at every institution, even at the same institution throughout different specialties is so different. I know you're willing to see patients a little longer. Some specialties, it's 18, you're done. So it's just a very important conversation to have with your provider, um, all of your providers, I guess, on when they have that cutoff to transition to adult care and how long they're willing to see you.
Absolutely. And I think it's good to have that early. So I
Hmm.
think people will start bringing it up around 16, which
Yeah.
I think is a really good time. And something that I thought about is should we bring that up, kind of hard, but we don't have as hard. I know some places have like
Mhm.
an 18, and
Yeah.
we don't. We typically will try to transition kids into kind of jobs and school and those types of things. But it's not an institutional demand that patients
Right.
will leave at a certain at 18 for sure.
Mhm.
And I think that the answer also really depends on, all those other factors that we talked about too, right?
Mhm.
Our patients, are they ready? Are families
Mhm.
ready? Are they medically stable in a good spot? And are there, available providers there? And so I think it's a really
Absolutely.
good conversation to have um, ahead of time. I think the one thing that you and I have learned as we've been
Mhm.
as we've been working with patients and families, is that really necessary for a transition to adult care is to transition to make sure you have a primary care provider.
I think that's the biggest thing. And I think that's what we've actually been the most surprising is these 18-year-olds that have gotten kicked out of their PCP office because a lot of the PCPs do, I feel like, kick them out a little earlier is what we've, I guess, have found. They don't. And they're just at a loss. Be like, well, you're my primary care now. And um, really urging them like this is important. You need a primary care provider for, I mean, just overall health and wellness.
Yeah, absolutely. And I think that's where if we have, providers who are med peds providers, so cross-trained in adult medicine and pediatric for our patients who have, chronic liver disease, biliary atresia, it's been really helpful to transition with
Absolutely.
into a med peds practice. 'Cause they're used to
Mhm.
practicing kind of in both spaces.
Yeah.
All right, so the next question that we get a lot is what happens when I move away? Um,
Absolutely. Another great question that we help them through this whole process. I think we've done it different for different families and what their needs are. We've gauged like, okay, like, are you moving away for good? Or like, is your plan to come back here? Where are you in the readiness to maybe transition to adult care? If you are moving away from good, is it time maybe we find that adult care provider for you in your college town? Or are we just going to help you identify a um, pediatric facility for maybe you to be seen if there's an emergency? Can we coordinate visits then when you're home for holidays and in the summer? Are you at a stable point to where we can see you every 6 months, every year, and really schedule those visits, those annual imaging for when it's convenient for you or for when you're home?
Yep, absolutely. And I know that, we are used to getting calls and our fellows will take parent and patient calls,
Mhm.
at least at Cincinnati. And I know we are used to taking calls from all over for those types of things. But I think I agree. It varies for the situation and for the circumstance. I think the other thing that we try to do is we will see patients a little bit more frequently before that
Mhm.
transition. So we usually will try, we'll try to see the patient before going away for summer. And then if they're home either on a fall break or a winter break, we'll often do that as well. And it's a really good time to kind of recalibrate, and I think this goes actually into the next question. Are there any accommodations for school? Is it we could talk about that, hey, do you need any additional kind of plans in place for your learning? Do you need anything for dorms or for residence halls, for food? And then we'll see.
How are you going to get your medication once you're off at college and you can only get 30-day supplies of meds? We need to find you a pharmacy close by. And do you have a safe space to store those medications once you bring them back to your dorm?
Absolutely. Absolutely. And I think that we've also, we're used to sending medications to the school. And then when they're home for break, sometimes they'll message and you'll message me, okay, great. We need to get them back home for the next 2 months while they're home and then away. But it's a really good time to see, hey, how did things go? And how can we help you and support you?
Absolutely.
And I think that what we find is that there's just so many transitions that are happening for kind of job, school at that time period, that if we can kind of create some degree of stability and kind of still serve as a medical home in those circumstances, it goes better.
Absolutely.
For them. All right. I think, Courtney, you get this one. I think.
Oh, yes.
You. So why can't I log into my child's patient portal anymore?
They turned 18. They're an adult. You can still get access, but they have to grant you that access. And you just have to go through a different process of getting logins and getting their approvals. They're growing up.
Absolutely. Absolutely. And we talk with the patient too. We talk with them, this is kind of what's changing. I think around 16, there's also kind of an ascent thing that happens too. And it depends. On some places it's younger and some places it's older. But we do have our conversations with this. And then we can also recognize that this can be a vulnerable time for us to be able to get a hold of and families too.
I think it's a good time for us though, too, to again, be like, okay, like this is a really good time you can still have mom and dad have access, like absolutely. But this is a good time for you to get your own login. This is the best time for you to then start taking responsibility, making these appointments. I know people don't like talking on the phone necessarily, but this gives you access to send us messages. Obviously, urgent things, we never want just a message to come across, but like this gets them practicing. If you need lab orders, just send us the message. And really taking control of their health and their care.
Yeah, I agree. So this one, I would say I get a lot. Am I allowed to drink alcohol? And this is a tricky one. And so I think that this goes back to helping create a safe spot in your clinic visit. The people that you should be talking about this with are your family, if that's a safe space, and then with your medical team, in terms of kind of alcohol. And I know that the concern is that, alcohol does have effects on the liver. And it really, everyone's kind of, everyone is a little bit different in terms of how their liver is doing and their liver health. And so I know I will often tell my patients, it really is best if you don't. But also kind of figure out, what are some of the motivations for that? Is it because there's peer pressure to drink alcohol? Is it because you feel like that's what everyone is doing? Or is it because you want to have it to celebrate, a special event and those types of things? And I think that we always talk about, I think that probably drinking is probably best not to, but if you are, we want to talk about it so that we can at least we can talk through, safe, how to be safe, and those types of things, but really encourage that conversation with your care provider and creating a space where you're comfortable having those conversations. So, and then I think the last one is, do I have to tell friends about my condition? And especially in kind of that transition of care and transition into adulthood. And I think that we've approached this, Courtney, in a variety of different ways in the clinic.
Absolutely. I think we've done, again, we've for sure have told patients like it's no one else's business. If you don't feel comfortable telling people and sharing that about yourself, it's none of their business. This is your private health journey and no one needs to know that you don't want to know.
Yeah, I think, yeah. And I think the other thing too that we really work on is to make sure that, patients and kids and young adults especially are
Mhm.
educated on kind of the liver condition, what happened.
Yep.
A lot of times, especially with something like biliary atresia, you're
Mhm.
diagnosed as an infant and you're not part of that part of
Mhm.
it, but making sure that you don't have any questions about it, and also making sure that our kids don't feel, guilty that this is not your fault. This is something you did.
Right.
This is, part of your health and part
Mhm.
of something that you're doing well. We want you to thrive with it.
Absolutely.
And if you feel like you're in a safe spot, in a safe environment, safe friendships to be able to have that discussion,
Mhm.
you can. And then I think we've actually offered, how to have that conversation with people. I think
Yep.
we've actually kind of walked through, how do you feel about it? Do you feel comfortable talking
Yeah.
with them? What would it take to be comfortable? And I think that, the clinic visit is a time
Mhm.
where, to even practice or even to talk about,
Absolutely.
so to make sure that you, like, your patients understand the condition,
Mhm.
but certainly not to feel pressured to share about it. But
Right.
it's just like everything else is a part of you. You get to kind of decide who and when you
Mhm.
get to talk about it.
Absolutely. And again, and obviously having the support is always great for if you have those people that you feel comfortable with sharing. And we do tell them as well as they're going off to college and maybe not at home, having the support, um, and just someone watching out for you, though
Yeah.
it is your private health, things like that. It's nice having those people around you that can be an extra set of eyes while parents are away.
Yep, absolutely. And we definitely send friends and friend partners who've
Mhm.
been incredible advocates and
Absolutely.
incredible support for our kids and young adults with chronic liver
Mhm.
disease too.
Thank you so much, Dr. Taylor and Courtney, for taking time to explain more about what transition of care can look like. We understand that transition can be a really challenging time for both parents as well as children. And we know this information will be able to provide additional guidance as well as support for people who are transitioning into this step. So now we are going to go ahead and shift gears a little bit, and we are going to speak with three of our patient advocates. We are joined today by Erin, Carly, as well as Sarah, all of whom have various experiences with biliary atresia. We will go on to discuss more about growing up with biliary atresia, as well as what life looks like for them today. Erin, I would love to go ahead and get started with you.
Yeah, sure. So I was diagnosed with biliary atresia in 1983, which was just like a few years after the Kasai procedure had even been created. I received my Kasai procedure pretty late, though. I think because of a lot of tests that were taking place, the doctors couldn't necessarily identify what I was experiencing. And so I was diagnosed late, and I had my Kasai procedure at 115 days. Um, I had a pretty normal childhood, Like some of the things that are interesting about my story is that I never experienced portal hypertension, I never experienced cholangitis. And okay, so this is kind of a sidebar because I'm new to AI. And so I was researching on AI kind of my story just to like get some statistics and some percentages and stuff. And so what I searched was what are the percentages of somebody receiving their Kasai procedure at 115 days and then keeping their native liver until 36 and then being double transplanted with a liver and a kidney and then having no complications after that? And it said the percentage is so small they can't calculate it. And so I just have to just be so thankful and grateful for what my journey is. I began getting really sick probably in around 2017 is when I began to experience liver failure. Jaundice of the eyes, my hair was beginning to fall out. One of the most difficult things about that time period was that I was having to present to society as a normal person while I'm having all of these medical issues. And it was challenging because when your body is full of fluid, a lot of times you can't fit your clothes. Or there were times when I had to come to work at a dress code with sneakers on because my dress shoes don't fit because my feet are full of fluid. And so it was a challenging time just to present myself and then also to kind of be happy about my circumstances, especially in the eye of uncertainty. And so time continued to progress. I eventually got released from my job and I got on unemployment, which was helpful, but then eventually I got disability, and that kind of helped with the financial aspect of things. But one of the things that's scary during that period is when your insurance falls off, and then you don't know you're going to pay for these things. I have a transplant that I have to look forward to, and I just got rejected from Kaiser for a transplant, and then I got placed on UCLA's list, and they took me right away. So I think one of the things I was able to do throughout my life is just gravitate towards those little small wins that I could get in certain spaces. So for me, the win in this space was covered California insurance, and I was able to get Blue Shield, and they carried me all the way through. 2019, I was admitted into the hospital, and this was in November. And it was probably one of the darkest days I ever experienced. I woke up that morning and I was just uncertain about life. And I just decided to tell myself, you know what, I'm going to get up today and I'm going to try to walk, and I'm trying to find some strength within myself because I don't know what's going on with my body. One of the interesting things about my eyesight is everything had a hue of yellow. My eyes were so jaundiced. So I went outside. I got up and I went outside and I walked down the street, and I got maybe 4 houses, and I was so exhausted, so exhausted. And then I had to turn around and go back inside. And I sat down downstairs at my parents' house and I just began to weep. I was crying so hard because I just didn't know. For the first time, it was like, I'm not in control of any of these situations. And when it comes to being prepared for a liver transplant, one of the things that is difficult in that process is your MELD score is not quite high enough for a transplant, but you feel sick. You feel so sick. And so I was in limbo for such a long time. And then finally, after that admission, they brought me in and they said, wow, you only have 2% liver function. And they don't know how I'm up and walking around. And one of the questions that it brought to my mind is during that period, how come there isn't closer monitoring, or how come there wasn't in my situation? How come I wasn't just getting daily blood work just so that they can continue to monitor anything that could shift at a moment's notice? And so I spent 4 months in the hospital. 3 months of that, I was in the ICU. I lost my vision. I lost my hair. I lost my eyesight. I lost my ability to speak. I was on TPN IV fluid. My body weight had dropped down to 115 pounds. I was in and out of medically induced comas for long periods of time. And during those periods, when my eyes would shut, I just wasn't sure if they'd open again. I had no idea. I had no idea if they'd open again. And so every time my eyes would shut, I'd see these dark colors, and I'd experience these battles, these spiritual battles where I had to decide between right and wrong and good and evil. And it was dark and it was challenging. And so I got my first transplant December 9th, 2019. And I remember waking up a few days after that, and I just didn't feel right. I didn't feel good. And after listening to some of the nurses, like, yeah, your eyesight will come back, and your eyes will clear up. So I'm looking at my support systems like, hey, what do my eyes look like? Or how's my body look? Or how do I look? It's interesting going through that process because there's no mirrors in the hospitals. So you have no idea what you look like during that time. But I'm so thankful that I didn't have a mirror to look at, and which would have caused my energy to shift maybe towards fear or doubt. And that's something that I didn't have the entire time. And so 5 days later, my doctor comes into the room and he said, hey, we don't like it. We don't like this liver. We're placing you back on the list. And that's a scary moment because now what does this mean for me? I'm in the ICU. I don't even know the last time I've even walked. I've been in the bed this entire time. And every time I close my eyes, I'm having these battles where I'm losing. And then I'm thinking I died. Then I open my eyes and I'm like, still here. And so having those such experiences, it kind of skews your perception of reality. And so even though my eyes were open and I'm looking at my family, I'm just like, I don't even think this is real. I don't think this is real. Maybe I'm in the waiting period or something, like maybe God has me in the waiting room right now and I'm just sitting with my family until my body rises. And it never does. And I remember one time after a really dark time of my eyes being closed, I looked over at my dad and I was like, Dad, I'm dead. And he looked over at me with this smile on his face and he was just like, well, then how are you talking to me? And like something just snapped. And I was just like, okay, okay, okay. Yeah, I guess you're right about that. How could I be talking to you? And it was just, moments like that with my support systems that really helped me through. I think one of the most challenging times while in the hospital was when my memory began to fade because the ammonia levels are so high in my brain. And I'm looking at my family and I cannot tell who they are anymore. And I remember their faces literally like fading. And I'm looking at my sisters and I'm like, you got to hang on. Who are they? Who are they? Who are they? And nothing is coming up. Nothing is coming up at all. And at that moment, I just remember like, I don't know anybody. I don't recognize any of these nurses. I'm just laying here in a hospital day after day. At this point, I don't even know why I'm here. And then they gave me lactulose, which is this disgusting syrupy medicine to clear my mindset. And I remember drinking that, and it didn't have the greatest effect on me. But one of the things I did remember was my name. And so the doctors came in and they asked me, do you know your name? Yes. Do you know where you are? No, actually, I didn't know my name. So they walked in and they asked me these questions, and they were asking, um, "Do you know where you are?" And I looked around and I'm like, "Yeah, I'm in a hospital." And then they asked me my name. I don't know my name. Sorry, I don't know my name. And the doctors were so sweet, and the nurses are always so nice. And it's okay, it's fine, don't worry about it. This is your name, and this is where you are. And we spoke to your family this morning. They're okay. They'll be here soon. And that felt good. I remember I spent my birthday in there, December 20th. I spent New Year's in there. New Year's Day, I woke up actually feeling good. They were giving me some protein shakes to kind of strengthen my body up. And then the day after that, I just remember being sick. The last thing I actually remember on January 2nd, 2020, was taking the covers and putting it over my head. And I don't remember coming out from those covers until January 15th after I had my liver and kidney transplant. So on January 12th, they told my parents that there was nothing more that they can go do for me. I had gotten pneumonia. I went septic twice. And they said the only thing to save his life will be a liver and a kidney. And so the liver and the kidney came December 14th, 2020, or January 14th, 2020. I woke up the very next day, January 15th, 2020. Interesting about January of 2020, I was only awake 4 days. January 1st, January 2nd, January 15th, and January 26th, which was the day that Kobe died. And that was so random. One of my favorite basketball players. And because I was full of so much medication, everything's moving so fast. So all the screen kept saying was Kobe died, Kobe died, Kobe died. And then after having the experience I had, it just seemed so negative. Like turn the TV off. I don't just play jazz. That's it. I don't want any TV. Play jazz and put on Price is Right and Family Feud, and that's it. I don't want to watch these things. I don't want to watch anything else. And so then began my journey of healing. I woke up again. They put me back to sleep at a specific angle for 2 weeks, and then I woke up again in February, and they shifted me from the bed I was in to this special bed where it would incline at a specific rate, because if you sit up right away after laying down for such a long period of time, your blood pressure can tank. And so every day it was just like bed therapy. It would raise like 15 degrees and then go down. How do you feel? They're monitoring my blood pressure. Then the next day higher. And then after a few weeks, it was all the way up to where it was like I was standing, but I'm like strapped to this bed and just looking around, hanging out, talking to my family and stuff. But and then they're closely monitoring everything. And it's interesting that when you don't use things, you literally lose your ability to use them. And so I had to go through swallow tests just so that I could eat again and drink water again. and then standing test. And it was so challenging when I was standing because my parents were in front of me, and I'm like, I've just been laying down. There's no way that I can't stand. And then I did my rock, 1, 2, and I tried to stand and nothing. And I looked at my parents and I was like, I feel like a failure. And they're like, no, what? After everything you went through, you're a survivor. Everything's going to be okay with time. And so I was released from the hospital a week before the shutdown, which was March 6, 2020. I went to a family member's home that we had leased for the first month because I had weekly clinics, and my parents live about 45 minutes an hour from UCLA. And then I had to get to work. And one of the main things that I did in that after process is I took it personal. Everything was personal. This life took so much from me, and I got to get it back with interest. And so I started walking. I started walking on my walker, and I had foot drops, so I had the brace on my foot too. And I remember one night I got up too fast and I didn't put the brace on, and my foot dragged and I fell to the floor. Have you ever seen used car salesman lots, and they have the balloon that's like going like that? That's literally what my body did when I fell, because my muscles were so weak and my limbs were just going everywhere. And that's literally what I look like. And but that fall took it personal again. I got to get this. And so I started walking, and then we moved back to my parents' house. And we moved back there at a time when I was finally strong enough to go upstairs, because my parents live in a tri-level. And so going up, but in hindsight, that was good workout for me. I'm working legs every time I got to get to the bed or go downstairs. And so I'm walking up and down the stairs and I'm getting stronger. And then I start walking outside with my sister with a cane. And then January of 2021, it was around the 20th, and I had my first panic attack, and I had no idea what was going on. I was sitting on the couch by myself, and I'm like, oh man, I'm gonna die, I'm gonna die, I'm gonna die, I'm gonna die. And it just kept going and going and going and building and building and building. And then I just stopped myself and took a deep breath, and I just grabbed onto the couch, and I'm like, you're okay, you're okay. And then shortly after, my parents came home, and I didn't tell them. I kept it to myself like any child would, and I didn't want to scare them after everything that they had already been through. But then the process began. I started walking a mile, and then after a mile, it was a mile every day. And then I went from 1 mile to 3 miles, and then I did 3 miles Monday through Friday, and then 5 mile Friday. And I started posting these things on Instagram, and I got to know people in the liver community, and people started walking with me. Like, some people aren't even sick, and they're walking with me, and they're checking in. They're saying, "Hey, I got my mile in. I got my 3 miles in," and it was just a good culture and a good community. Um, and that's kind of like been the gist of my life and my story. I've now run a couple of 3Ks and 5Ks, so my legs are back in shape. I recently got my black belt in mixed martial arts. Those Price is Right shows that I was watching in the hospital, they must have manifested themselves, because I went on Price is Right and I won the showcase, and I got a couple of vacations, and I got a big TV. Um, and recently, I received a Courage Award, 2025 Courage Award from another liver foundation, and they recognized me for my courage. And I've been given speeches, and and that's just the main thing of this journey. I always say that we're all so much better when we're connected, and that's why I'm thankful for this opportunity to just come and speak, because there's somebody or anybody that could be experiencing what I'm experiencing, or may have gone through what I've gone through. And just by seeing me or hearing my story, it gives them the piece of hope that they need, maybe to just get out of the bed that day, or go for a walk that day, or lift a weight that day, or drink a little bit more water that day, or whatever they need to fuel their body. And so that's been my mission now, to just go places wherever necessary. You hear motivation everywhere, right? You hear it in all different spaces. You can go online, and if you're looking for motivation, you can find it. But in the spaces that we exist in, sometimes you need to hear a voice in a specific way from a specific person. And if I can be that person to maybe just a couple of people, then I feel like none of this was done in vain. This is all done for a great purpose.
I cannot thank you enough for sharing your story, Aaron. And I know so many people will be able to have those shared experiences with you, especially coming in through adulthood. I am so just floored by your story constantly. And I love how you incorporate the really challenging pieces, but also the really inspiring pieces, and how full circle your whole story really came from start to finish.
Yeah.
So I cannot thank you enough for taking the time to really share the things that people don't want to talk about. You know, we often hear, like you said, there's motivation everywhere, but sometimes that motivation does really have to come from within. And you highlighted that so beautifully in your story. So
thank you. Thank you.
Thank you. Carly, I'd love to turn it over to you to share more about your story as a caregiver and your daughters as well.
Sure. I want to make sure you can hear me okay. Everything's still good? Okay. Well, first of all, I want to just thank Aaron for being open with his story. It is you're just a miracle. It is really inspiring to hear everything that you had been through. And I was taking notes because I feel like you spoke to a lot of things that I relate to as the mom of a liver recipient with biliary atresia. So just thank you for sharing.
Yeah, you're welcome.
Yeah, my name's Carly, and I have a daughter who is 8 years old, and she is 7 years post liver transplant. She was transplanted at 13 months. We found out that she had biliary atresia at 6 weeks old. I knew right when she was born that something didn't quite feel right. I had 2 other children. She was my third, and her eyes just, I guess, mother's intuition, like her eyes just looked funny to me, but they weren't jaundice. They looked gray. And so was dismissed, which can happen a lot with biliary atresia, although there are people making like strides with trying to inform the public and inform healthcare providers on like what to look for with this disease. So very thankful for that. Was a little bit dismissed at first, and then finally there were other signs that got to the point where we ended up figuring out that she had something going on, and that kicked off a whirlwind of events in our lives with her and biliary atresia. We were in and out of the hospital, our children's hospital here locally, for that whole first year. It was very hard. The uncertainty, I relate to you, Aaron, just knowing that, you know, maybe she would be okay, but maybe not. We had the Kasai procedure, but just being in limbo and having our whole life disrupted was very, very hard. And it was very isolating to be in the hospital during that time, and just, you know, trying to make sense of what was going on, just being in crisis mode. In the middle of all of that, we were also piling on another big life change. We were moving at the time as well. So luckily we had good family and good, you know, people around us that really helped that transition of us being in and out of the hospital and then also moving. But that is where Sarah and my story overlap, because we moved into a little cul-de-sac, and we eventually brought Zoe home to this house from the hospital. And I was dealing with just having a lot of, I guess, really just depression from being in this crisis and not really knowing what was going to happen. I just was really struggling mentally. I was still postpartum. I was just really not in a good mind frame. And so my husband was out one evening and happened to meet Sarah's husband. The neighbors, we live in a little cul-de-sac. We're all close now, but at that time, you know, people are curious about who's the neighbor moving in. So my husband was outside talking to Sarah's husband and explained that we had a daughter that we were bringing home from the hospital. And he mentioned that she had a rare liver disease, and Sarah's husband responded with, "Oh, is it biliary atresia?" Like just rattled it off. Well, we know how rare biliary atresia is, so my husband assumed he was maybe a doctor. But as it turns out, that's what brought Sarah into our lives. We ended up right next door to each other. And so she became just a good, I mean, a best friend, but also just somebody who I could talk to that understood, you know, just this disease. She has a whole family who had been through it with her. And so just somebody who could give language to what I was experiencing with Zoe and just give me different perspective. And as Zoe's gotten older and things have changed and we've been in transition with her understanding more of her own health and her own journey. Like Sarah's just been a good sounding board as somebody who gets it. And I will also say that some of that, what you talked about, Aaron, with like that internal drive, like the feeling of panic and anxiety, but then also the drive, like you're going to keep going. I see that in my daughter. It's like this grit. And I think that maybe this could be common in medical kids, but I also see it in Sarah. Sarah has that as well. And I wanted to tell you too that everything you were just describing with your medical journey, Sarah and I are both second career nurses. And so we're just sitting here like, yes, we understand a lot of just medical stuff of what you're explaining too, just to give a different layer of how things overlap for us. So that's kind of the gist of Zoe. She's been very healthy. We've had one hospitalization in kindergarten. She's in third grade now, and it was very tough on her because it was kind of like the first thing that she could remember. So I've learned a lot about how there's a lot right now about like how your nervous system handles trauma. And so when people are put through medical trauma and kind of poked and prodded and don't really get a say in anything, that really shapes your personality, that really shapes your nervous system. And so some of what we see right now, I really think ties back to her babyhood and going through a lot of medical trauma. The hospitalization in kindergarten was really tough on her. And I look at it as kind of a turning point. Since then, she has started asking more questions. She has opened up more. Last year was like the first year that she really started sharing or talking about it. And so it's just been interesting to see how she is changing along her journey. So, and that includes going to liver clinic visits and labs and everything.
I love that you were able to share a little bit about Sarah's and your introduction and just what a neat overlap that really was for both of you, and at what an incredible time that came just as Zoe was getting ready to come home and being able to have that accidental support system that you didn't even know was going to be there. Sarah, as Carly has alluded, you two know each other well, and you yourself are a biliary atresia patient. So I would love for you to share a little bit about what life for you is like growing up and where you're at today.
Sure, absolutely. First of all, both Carly and Aaron, you guys, you have me emotional over here. Goosebumps for sure. Aaron, your story's unbelievable. And like Carly said, also as a nurse, I'm an ICU nurse, so taking care of critically ill patients and then knowing all the things that you've said, but then also just, I don't know, feeling it from a totally different perspective is like, that's a gift to me as a healthcare provider. So thank you.
Yeah.
Thank you. Yeah. The Andersons moving next door also was one of the best gifts that I ever have received. Carly has this unique way of just drawing you in, and she has done more for me with my own biliary atresia since we've become friends than, like, as far as facing it, acknowledging it, doing something about it. This is my first like public speaking little gig here, thanks to Carly. I'm 46 now, born in 1979. I had my Kasai when I was 6 weeks old at Riley in Indianapolis. And like Aaron said, back then, the Kasai had not been around in the United States for very long at all. And biliary atresia was really, and to some degree, I think still is, but a diagnosis of exclusion. They told my parents that if I was lucky, I had cystic fibrosis and that maybe I'd live to be 2. And so there was just, there wasn't a lot known at that point in time. And the Kasai looked very different than it does now. They made 2 stomas. The first stoma, they would hook an ostomy bag to, and the bile would drain into the ostomy bag. And then my parents would refeed that bile into the other stoma. They made sure everything worked properly. And then there was another surgery called a takedown where they would go and connect the loop. So then you didn't have any ostomies anymore. And then the bile would flow through the loop on its own. So my parents jumped in head first, learned all they could about biliary atresia. We have a connection to the American Liver Foundation. They helped found the first chapter in Indiana. They became very involved to make sure that I lived. My loop got a kink in it when I was around 2, so I had to go have another surgery to have a revision. I had 13 hospitalizations before the age of 3. I had a lot of issues with cholangitis. And so we lived in Northwest Indiana, so my parents would zoom down 3 hours to get me to Riley as fast as they could to get me admitted and taken care of. So I spent a lot of time before the age of 3 in the hospital. But from 3 to 17, I lived a very totally normal childhood. No admissions, no illness, just my regular checkups. And at 17, we went to San Francisco on a vacation, and I got really sick. Horrible abdominal pain, fever, sick. We went to the emergency room, and that was the first time that I really realized that I had something that people didn't understand or really know about, especially as a 17-year-old, a pediatric disease, but an older pediatric patient. They, were going through all these scenarios, and my parents were trying to describe what I had going on. And they thought I was having issues with my gallbladder, but I was born without a gallbladder, and all that. And finally, a pediatric doctor from upstairs, a GI specialist, came down and kind of got everything straightened out and was like, nope, this is cholangitis. And that was the first time as more of an adult that I realized kind of like the gravity of like what this could be. Went on to college, grad school, had minimal problems. It wasn't until my late 20s that I started to have more reoccurrent bouts of cholangitis. That I'd be hospitalized for a few days on IV antibiotics. One stent I was in like 10 days. I could get septic, and I could get septic really quickly. It would happen like in hours, a matter of hours, that I would get really, really, really sick. Went on, got married. We decided to try and start a family. And I'd actually went and consulted with a couple like biliary atresia specialists throughout the country to kind of get the green light that it was safe to try and get pregnant. But there were just so few adult doctors that really had a grasp on, adult BA patients, Kasai only. But I got pregnant, and about halfway through my pregnancy, around 20 weeks, I started to get really, really sick again. My liver did not tolerate being pregnant. And I ended up the second half of my pregnancy in the hospital for a lot of it. PICC lines, once again, really, really, really sick. I was told all sorts of things, like the left lobe of my liver would have to be removed, that I had a clot in my portal vein. I was induced right at 37 weeks. Luckily, my daughter was very healthy. But postpartum, I faced a lot of complications, just continued bouts of cholangitis. And that went on for quite a while. I had every diagnostic test, liver biopsy done. And at one point I was inpatient, and my doctor walked in, and he just looked at me and he said, your Kasai has failed, and you need to be on the transplant list. Luckily, I got better with conservative treatment, and that never happened. Since then, I had another big setback in 2018. I ended up with a bowel obstruction from scar tissue from my surgeries as an infant. Scar tissue wrapped around the small intestine, and I had to have a bowel resection. And then I've had one more big bout of like bacteremia that put me inpatient. But besides that, I have been very lucky, very blessed. Overall, I live a very, very normal, full, healthy life. I work full time. I have a family. I'm able to be physically active. And I have found myself now in a really good place with my adult GI doctor, where we have this great like relationship that he knows that if I tell him I don't feel good, that we better get stuff moving. He gives me standing orders for labs, so I can just go and have labs drawn. And I think that's been really huge for me, knowing that I have that like autonomy and that relationship with my doctor to be really proactive with my own healthcare. So.
Okay, well, I can't speak for everyone, but I was having a hard time keeping it together for all of your stories. I think all of you relate so closely. Carly, I do want to come to you. I cannot thank all three of you for being here just with us and being so open and raw and honest about your experiences. So often what we hear about are the early years and those really challenging days. And I know, Carly, I can't speak for you, but I did walk a little bit of Zoe's journey early on with you. And it can be so challenging to see what comes later. And I can only imagine what it felt like to meet Sarah, who has been through this journey as an adult with a family and who, as she so beautifully put, has this autonomy and this great relationship with her provider, because as she has transitioned through adulthood, you've been able to build that rapport and, you know, your doctor trusts you and you've been able to medically advocate for yourself as an adult to say, I know what's wrong with myself. And that is something so powerful that I hope that we can spread to other parents right now to help their children as they transition up to be their own medical advocates and to have that power to say, no, I understand what you're telling me, but I know my body. I have lived with this illness for my entire life, and I know when something is wrong. And that's really a powerful point for you to make, Sarah. Carly, I'd love to hear you.
I agree with everything you just said, but I was just going to make the comment that when Sarah was talking about her, one of her setbacks with the obstruction from scar tissue, this was at the time where Zoe was being listed for transplant. And so we had Sarah spearheading as she was going through all of this on her own, spearheading like fundraising for my daughter Zoe from the hospital. Like there's nothing that was going to stop Sarah. This is what I mean just by grit, like just in her personal life, but also just like her just love and care towards others. She's just a very good human. She was in the hospital dealing with her own health crisis while also like planning a huge fundraiser for CODA, Children's Organ Transplant Association. She was then discharged after dealing with her own stuff, but still connected to PICC line, TP, like just still did everything. And she forgets to mention that part of the story, but right when we were like at the beginning of our, transplant, heading into transplant, and it was just very touching and just speaks to who she is.
One thing you've all pointed out is that sense of community. And I feel like the BA community is no different. And that all of you have mentioned the people that have surrounded you and those support systems. And it's so unique to have, of course, neighbors. But Erin, I know that you also function with other BA organizations and have the opportunity to speak. Can you talk a little more about the community that you have found? You talked a lot about your parents and your siblings being at the hospital with you. And I think so many people can relate to having that immediate kind of family around and that immediate support. But what is it like as an adult who went through so much with a relatively easy childhood to have that sense of BA survivors and thrivers out there with you? What is that like for you?
It's been interesting because all throughout childhood, I thought I was the only one like me. There was a liver newsletter that used to go out to my mom every 6 months. And I know that there was somebody that was about 10 years older than me that lived a few cities over. I never met them, but I knew that they existed, but that was it. I think one of the good things about my childhood is my parents just treated me normally, and so did my close friends. Post-transplant, the reason why I say it's interesting is because I found a lot of these people through hashtags. Just hashtagging biliary atresia and hashtagging liver transplant. And these communities find you. It's like we're looking for each other. And one of the groups is the Biliary Atresia Research and Education group. And it's been amazing just getting to know some people through that and also being a resource to people who are just experiencing what I've experienced, and then as they prepare for potentially going through what I went through, then they can hear my story and kind of brace themselves and like hopefully they don't experience the things to the magnitude that I did. But it's just been really amazing. I've felt like the more people I meet, the more it's like family. I remember going to like a work conference, right? And when you go there, they're like, "Oh, so what do you do?" And basically, the questions that they're asking is to count your pockets, right? To see where you are in terms of your status. What are you doing for the company you work for, and all of those things, right? But then when you go to a liver-related event, people are asking you about your story, and they want to know honestly and genuinely, how are you doing, and how are you feeling? How did you survive these things, and what did you go through, and how did you find the strength for this and for that? And it's so much more impactful to go to events like that. And I'm just filled with so much gratitude. That post transplant has just been nice in the way that I've been able to build community with people. I think my friend that's furthest away lives in England. I've never even been there before, but we constantly communicate on Instagram, and he sees me lifting weights, and then he'll go out and start lifting weights and running. And then there's another guy who is in Canada, and I've never met him before, and we just kind of talk back and forth. And then I call her my BA sister. She lives in San Francisco, and I've been able to hang out with her. We actually met up at the transplant games, which next year will be in Denver, but this was in San Diego 2 years post transplant. I met her there and met some other people, and it's really been amazing. It's been amazing just meeting people and then being able to talk to people, especially people who still have their native liver. I think my perspective kind of gives them some insight, but they also have access to other research that shows that you might not have to have a transplant, and that's amazing too. Like I went through so much, and I if I had to go through it to take away that experience from other people, like if I had to take the hit for that, then I'm more than happy. And if I had to go through it again to have access to this information and to these stories and these experiences, as tough as it was, I'd go through it again.
That's really sweet, Erin. And I can just hear the passion in your voice just surrounding the entire community and just yours and Sarah alike. And of course, Carly, but as 2BA adults being able to share, it's been really hard, but look at these outcomes. And here are my struggles, but we're still fighting. And I think that is just, as Carly and I have talked about, it provides a lot of hope. It provides a lot of insight. It provides perspective as kids continue to get older and what the challenges may or may not be. You obviously, Erin, you've had a transplant. Sarah, you continue to have your native liver, which is incredible, despite all of the setbacks that you've experienced over the years. And so it's two very different but very similar shared experiences. Carly, I have a couple of questions for you. One of them relates to as Zoe has gotten older. What has that looked like in terms of her taking over some of her care, some more, you mentioned she has a little bit more understanding of BA now and that she has questions related to her own health. So how have you supported her? How has, the institution she's being followed through with, how have they supported her as she's aged, saying, maybe these are responsibilities that you can look after, especially being a transplant?
Mm-hmm. These are good questions, and it definitely has changed as she's gotten older. I can tell you just a couple stories about how she's handled some of her own health advocacy. She has always been really good about getting labs. So her labs right now fall once a month unless there's a reason to more frequently. And so she has a relationship with all of the people that have drawn her labs. So that is helpful that there's like familiar faces. They know her. They've done it since she was a baby. Now we've made it kind of like an event when she goes to do labs, like we'll get a donut, like we have our routine. She'll get a donut after she knows she's going to see these people. So I think that's been good. She tells them now like which arm she wants to have her labs drawn in. She tells me if she wants to sit in my lap. It's just changed over time, like as opposed to having this little baby that feel like you're torturing and they might not be able to get labs drawn right away. That's hard on everybody. When she was hospitalized in kindergarten, she was able to like advocate for herself, like telling people like, I don't want anything sharp, anything like that. Just at that point she had an IV, but she got poked and prodded and she was able to tell them like exactly what, Sarah does. She definitely will tell you what she's thinking and she will advocate for herself. A big hurdle for her was learning to take medication, so swallowing medications. And so we were on liquid medications for a longer time because I didn't want to pressure her and push her. And then one day we just decided we paused it for like a year. Like we tried it, felt like it was probably too much too soon, and then let a whole year go by until she kind of seemed like she was interested and ready again. And then that was a big hurdle to get over because she does take a handful of medication still. She loads her pill box herself. So like we'll get it out. She'll do it herself with all of her medications, like morning and night. I anticipate that next steps will look like probably setting an alarm to see if she'll, just get her into the routine of, time sensitive medications and doing that on her own. She most recently at our liver clinic appointment brought up to our team, like, do I have to take these medicines the rest of my life? And so that actually spurred a conversation of them talking about potentially stopping one of her anti-rejection medicines that she takes. She had rejection early on, so then they like double covered. It was kind of significant rejection, and so she's just been on that since, but it's a very low dose, and so she is a good candidate to stop that medicine. And that was all spurred by her, being annoyed that she has to take medicine. So that was interesting. And I think that we every year around her transplant anniversary, which comes right after her birthday, is when we really talk more about it. Like throughout the year, we're just kind of like normal kid mode. She's in school, she's playing with neighbors. I've really followed her lead on things. And so this last year, she was sick on her birthday. But her transplant anniversary comes right after her birthday, and she didn't get to have a birthday party, but then she was like, I don't care about having a birthday party. Let's do something for Riley kids. So her and I together planned this, to do something for our local hospital, which was in partnership with her classroom and her school, collecting squishmallows for Riley. So she kind of spearheaded this, we made a video and she shared it with her class. So she was just felt empowered to share more about her story. And so I'm just kind of following her lead as she shows that she wants to know more. Mental health has become a bigger deal in our lives because she does have anxiety, and we've seen like behaviors and stuff, which I think is really normal with medical kids who have felt out of control, but don't really have the words to quite process everything yet. So like we are trying to make sure that we have good support in place, like for her mental health, and just to be able to have coping skills and stuff as she has more questions and figures things out. So that's where we are right now.
I appreciate you sharing more about kind of where Zoe is. And that has to be a great feeling to watch her sort of empower herself and being able to go to the doctor and be like, I don't want to do this anymore. And they're like, all right, well, let's work with what we can, It's not always like a full, reprieve, but it sounds like she was able to negotiate a little.
I find myself like, the further we get from transplant, like it's amazing. I'm so thankful, but it's like terrifying at the same time. Like it's terrifying. Like, oh my gosh, that's another year. Like now we're further out from it. And I think anybody who's been through that medical trauma, like you always kind of feel like, when is the other shoe going to drop? Like, is something going to happen? Like you have to really work to stay in the moment and not let all that anxiety and fear take over. So sometimes for me, it's slightly terrifying.
I can relate to that because I felt that same thing after a year. Then they graduated me from kind of like that clinic program. I'm like, okay, well, when do you want to see us? Like 3 months or 6 months? And I'm like, I'm not ready for that. Can we just do next month? And then maybe after that, we'll think about 3 months, and then we'll think about 6 months. So I can definitely attest to that. Right away, it's like, you guys are like my security blanket right now. So I don't really want to let go of that. But it's also liberating to know that you're feeling so much better. And I remember when my liver appointments went to just once a year, I felt empowered. I just felt like, I've been doing the work and my body has been responding well and it feels really good. But initially though, it's anxiety feeling for sure.
I
We
think the
oh
other
go
thing that's going to
ahead.
be really neat for Zoe as she grows up. Obviously, I'm a connection for her. Sometimes we compare scars but she's growing up in a time where she can have connections because of social media and
Right.
things like this. Like Erin said, before the Andersons moved next door, I'd never met anybody like me before. I had no idea. And so I think that will be a really, really cool thing for her.
That is kind of a good intro to the next question I have for you, Sarah. So you mentioned that, again, similar to Erin, your childhood was very normal and really similar to Zoe for all intents and purposes up till now. She gets to be a regular kid. Erin, you said you didn't really know that there was anything wrong growing up. And Sarah, you kind of echoed similar, situation until you were 17, you said. And that was kind of the first true awareness that you had of, oh, wow, I can get really sick really quickly.
Mm-hmm.
Can you talk a little bit more about what that was like in the coming years for you? What that was like to have this pause moment where you thought everything's been really normal, I'm really healthy up until now, and then all of a sudden you're at that age where essentially, you're expected to spread your wings and take the next step into adulthood, and you're like, holy cow, here I am. I'm really sick. This is something I'm going to have to, continue to fight from here on out. So can you just speak a little more to what that was like for you?
Yeah, I've told Carly before, when we've had conversations, I describe it as I'm fine till I'm not. And it really happens like that quickly. It starts with like you feel like you have the flu. For me, that's how it's always been for me. And then within hours, I can be really sick. I remember one time I went to an emergency room because that's kind of like the protocol. If you spike a fever and you have that pain, you go. And I was sent home being told I was drug seeking because I knew my symptoms before my liver numbers even spiked. And I went back about 6 hours later, and sure enough, my all my numbers were very elevated, and then they admitted me. So it's just I remember making a document of everything that had ever happened, and if I was going to go to the hospital, I would just take the document because people don't understand adult Kasai only patients. They don't see it. And in my adulthood, kind of finding what do I want to say, specialists in adult Kasai only, a specialist or somebody who treats a lot of Kasai only patients might have two adult Kasai only patients. So it's just been really interesting seeing how rare that is, and then just the not understanding, and then once again how fortunate I feel that I've developed such a great relationship with the GI doctor that I have now, and that he really trusts me to kind of navigate and dictate, not dictate, but you know what I mean? Like, if I tell you I'm not well, I'm not well. So let's make a plan. Yeah.
Yeah. Well, we have time for one more question. Carly, this one is going to come to you. Now, you had mentioned earlier on that you had two other kids prior to having Zoe. Can you just briefly speak to what it has been like for your other two kids in relationship to Zoe navigating these journeys and you as well with them?
The first word that comes to my mind is hard. Sarah has witnessed, we've been raising our kids together. I have two older boys that are now ages 13 and 11. I went to Bayer Biliary Atresia Research and Education, their conference in Chicago. It was like their inaugural liver conference. And there was a slide that I took a picture of because it stuck out to me. And it was one that talked about the siblings of kids who have had a chronic illness and what that does to shape those siblings. Like, it makes them resilient. It makes them more compassionate. They have more patience. And I just needed that hope because it has been hard and it has gotten better over the years. But when they were little, we were torn apart all the time, in and out of the hospital. They didn't understand anything. It was really hard on everybody. We had a good support system in place, but that stayed with them. And as they got older, I think there was some resentment about her extra needs. We've tried really hard, just, every kid's different. So you obviously like tailor your parenting differently to every kid. But I think there has been resentment at times towards her, like as she has struggled with anxiety and behaviors and just, just some of the extra needs that have come out that we didn't anticipate in her babyhood. Like her young childhood has been challenging in ways that we did not expect and that we didn't have with the boys in the same way. I think that as they've seen her go through stuff, like, so I brought them to labs with her one time and they had to see her get labs. And as they have seen her get sick in kindergarten, be hospitalized for that time period, like, I think they have, as they've grown up, started to understand more, like she does have more to go through. There is more to her story. And I think that that has made them proud. We participated in our local organ procurement, it was Strut to Save Lives. So I brought my middle son, and there was like having like 100 therapy dogs. There was like dogs everywhere. So it was great. But I think just being able to kind of see like some more of her world and what that means for her. And I'm starting to see like that compassion and more grace towards her, which I'm very thankful for. But there are times where it has been very, very challenging.
Well, I appreciate your honesty, and we are going to wrap up, but I would love for Sarah, Erin, and Carly to just share one small tidbit of hope or advice or encouragement that you would give to either your younger self or give to a parent of someone who is currently in the early stages or maybe in that transition period where they're encouraging their children to learn more about, what BA is and what their future could look like. So Sarah, we'll kick off with you if you have either a piece of advice for your younger self or for parents.
I think the biggest thing that I've learned as an adult looking back is to embrace mental health and therapy earlier. It just wasn't a thing as I was growing up. And I think it's become more of a piece of the whole, medical journey now with kids with chronically ill issues. But I think that would be my biggest piece of advice, whether you think your child needs it or not, or you think you need it or not. If you've endured medical trauma, you probably do need to talk to somebody because it's a lot.
Yeah, that's really great and solid advice. And I appreciate that honesty because I know that's not an easy topic to approach. Erin?
I kind of want to touch on both.
Yeah.
I think to my younger self, I would just say to try it all, try everything, no limitations, just go out there and live your life. I think for a lot of my life, I placed sort of a plateau on the top of my head, thinking in the back of my mind that one day I'll have a transplant, and I allowed that to kind of guide the decisions that I was making in my life and not really putting myself out there and allowing anxiety to take control of the decisions I was making. And so just putting myself out there is definitely what I would have told a younger self. In the end, it'll work out, but just have fun and try things and do stuff. And if people are staring at you too hard because you have scars on your stomach, make up a story. I got into a ninja fight, or some sharks tried to bite me or something. Like some of the things that I just used to make up with my imagination when I was little. And to parents, just stay close. I know a lot of times there are kids who get annoyed by their parents just being by their side or being in their business or being in their medical files and like over talking and answering for them, but you'd much rather have them there than not. And so I know my parents would bug me a lot when I was a kid and going to doctor's appointments, and they'd ask, how are you feeling? And they'd answer, and then I'd jump in and I'd answer. But if I didn't have that, then I would have felt more alone. And like Carly was saying, create those rituals. For me, every time we went to the doctor's appointment, it was numero uno pizza. And I love that pizza. And I went and had it as an adult and it was trash. It was so gross. But I think it was just the tradition that was created. And most of the time it was me and my mom because my dad's a firefighter and he just had, kind of that crazy schedule. And so my mom being a real estate agent, she could just drop everything and come by my side, or my two older sisters. And so, but yeah, my advice to parents is just stay close. And even sometimes if you have to be annoying, just be annoying because you're going to need that peace of mind too.
That's such great advice. I love both of that. Carly?
I would say that just looking back on our situation, it is very normal for people to be very curious, like about others that are in a medical crisis, and then to go on with their lives. Like, so I think people show up at different times in your life. And just know that it's normal that there are going to be like seasons in your journey where you might have a lot of support from people and then people go back to their lives, and then your friend group might change. Like the things that you have gone through, not everybody can relate to. And that's okay. Like things change, relationships, friendships change, but that will open up like your world to different new people coming into your life. Like we've talked about like through Bear and just meeting people who do understand what that journey feels like, because it can feel really isolating when you're thrown into a crisis and then, you're different, things change, like it really changes you at your core. And then I think also another thing would be just like, I felt so out of control of what was going on. And so like a way to deal with that anxiety was to try to like have control over everything, but just knowing that, like, just trying to take a step back from that sense of control and uncertainty and just try to like live in the moment. And it's so hard to do with a chronic illness, a critically ill baby. Like it's very hard to do, but I think just trying to, as much as possible, like just release that control, find an outlet for that, whatever that looks like for the individual. So those are my two.
Well, I cannot thank you guys enough, Carly, Erin, Sarah, just for being with us today and really just opening up and sharing the truth behind your journeys and just highlighting more about the ups and the downs and what tomorrow has brought for all of you. So thank you so much for being with us today.
Thank you.
Thank you.
If you are looking for more information after today's program, we encourage all of you to visit liverfoundation.org. There you can also find details about our virtual as well as online support groups, as well as other opportunities to get involved as an advocate yourself. We also invite you to connect with us on social media. You can find us on Facebook, Instagram, LinkedIn, X, which is formerly known as Twitter, as well as our YouTube channel. We look forward to staying in touch. Thanks so much for being here, everyone.